we quickly look at hypokalemia. Hypokalemia is simply potassium concentration that is below 3.5 millimoles per liter. Potassium concentration that is below 3.5 millimoles per liter. Now, hypokalemia can be severe and it can be moderate, right? Now, in moderate hypokalemia, serum levels of potassium will fall between 2.5 to 3.4 millimoles per liter, while in severe hypokalemia, potassium level is usually below 2.5 millimoles per liter, right? Now, hypokalemia can be very life-threatening, right? And it can be very, very life-threatening. It may result from inadequate potassium intake or increased potassium loss. It can also result from shift from the extracellular compartment into the intracellular compartment, right? But the most common cause of hypokalemia is the excretion, increased loss or increased excretion of potassium. That's the most common cause of hypokalemia. Now, before we go into the types of hypokalemia, we could look at or before we go into the individual causes of hypokalemia, we could quickly look at the symptoms. Now, the symptoms of hypokalemia depends on whether it is mild or it is severe. Now, people with mild symptom may not know whether they have hypokalemia because the symptoms is very mild and it does not really show. But some people may not also have any symptom at all. Now, when symptom appear in hypokalemia, the symptom are diverse. Now, examples of symptoms that are associated with hypokalemia include muscle weakness. In severe cases, the muscle weakness can even result in paralysis. The person can be paralyzed. Now, why? Because you know that the muscles, for muscles to be able to contract or to get active or to engage or to be engaged in activities, potassium is one of the requirements. Potassium is one electrolyte that is important in the functioning of the muscle. So in a situation where potassium level is low, there's muscle weakness that can result in paralysis if it becomes very severe. There's respiratory failure too, because even the diaphragm and the lungs, they require muscular activity for them to be able to effectively um, function. So respiratory failure is there. There's low blood pressure as well because the heart muscle also require potassium to function effectively. So if potassium is low, then the ability of the heart to pump or to function properly will be reduced, and that will result in low blood pressure. And then there's also muscle twitching. When there's low potassium, because the muscle cannot function, they begin to shake, they begin to twitch. You can have cramps also. People who have low potassium, when they engage in any little exercise, before you know, they'll be having muscle pull, muscle cramp, right? That's also another symptom. Then excessive thirst is also another symptom of hypokalemia. Then excessive urination as well is another symptom of hypokalemia. Loss of appetite, nausea, vomiting, constipation, as well as cardiac irregularities. All these are symptoms that are associated with hypokalemia. They are associated with hypokalemia. Now, let's look at the causes of hypokalemia. We've talked about either increase loss or reduce consumption. So let's begin with gastrointestinal tract losses. Now, the things that can cause excessive loss of potassium associated with the gastrointestinal tract include chronic diarrhea, chronic diarrhea, chronic diarrhea. Now, when somebody is having chronic diarrhea, stooling, with excessive stooling, there's also excessive loss of potassium alongside other electrolytes. So that's why you see when somebody is having diarrhea, particularly children and even adults, they recommend ORS because part of the things that will restore loss of electrolyte is the consumption of oral resuscitation serum that contains um, certain electrolytes. Then also clay. particularly bentonite clay. Now, then bentonite clay is a kind of stone, a kind of clay that is ingested. Some people just ingest it for pleasure sake. Some people ingest it for pleasure sake. Now, that clay, when it's consumed, it has ability to bind to potassium. So when you are consuming the bentonite clay and you are eating meals containing potassium as well, that clay can bind to potassium that is present in the diet. And so the potassium will now not be absorbed into circulation because they cleave to that clay, and that will affect absorption of potassium. Now, another thing too that can cause gastrointestinal loss of potassium is villous adenoma of the colon, which causes potassium um, secretion or potassium excretion. Now, this villous adenoma has to do, the villi of the intestine of the intestinal wall. Now, that villi can have it can be there can be adenoma there that can hinder the absorption of potassium into the circulation, and so with that, potassium will be secreted instead of it to be absorbed. In fact, there will be potassium loss into the GIT, and it will go out through the stool. So potassium will not have access into the body in that situation. So that's gastrointestinal loss. Another loss is through intracellular shift. Now, a situation where there is a shift of potassium from the extracellular compartment to the intracellular compartment. Now, in um in glycogenesis, in glycogenesis where there is in glycogenesis there is in glycogenesis insulin is involved, because insulin is involved in the conversion of excess glucose, right, to be stored, driving in glucose to be stored in the cell. Now, when there is um, insulin is trying to drive in the glucose into the system, then potassium is also driven in alongside into the cell. And so in that situation, there is shift of potassium from the extracellular compartment to the intracellular compartment. And remember that when we are measuring potassium, we measure the extracellular potassium, because we do not measure intracellular potassium. And so when extracellular potassium is lost, is low, that's what is classified as hypokalemia. It's not total body potassium. So anything that will facilitate the driving in of potassium from the extracellular compartment to the intracellular compartment can cause hypokalemia. So in the presence of insulin, whether for glycogenesis or there's administration of insulin to clear off glucose from the circulation, in any of those situations, it facilitates the movement of potassium from the extracellular compartment to the intracellular compartment, predisposing that individual to hypokalemia. And also in renal potassium loss as well. Now, when when there is hyper aldosteronism. In hyperaldosteronism, potassium, sodium is absorbed, and in exchange potassium is secreted. So potassium can be also lost through the kidneys if there is hyperaldosteronism. Then there's also renin. If there's renin secreting tumors, in the RAS system, it can at the end result in sodium retention, and anything that results in sodium retention can result in loss of potassium. So when there's sodium retention, there's loss of potassium, and that can also result in hypokalemia. Then there's also certain drugs that individuals can consume that will facilitate the loss of potassium through the kidney as well. For example, thiazides, and then loop diuretics, and then osmotic diuretics, and as well as laxatives. All these medications can facilitate the loss of potassium through the kidney, the body. So these are causes of hypokalemia, and hypokalemia can simply be diagnosed by measuring of serum potassium and if potassium level measured is less than 3.5 millimoles per liter, that is hypokalemia. Treatment can be done depending on the cause of the hypokalemia.